What are the latest WHO guidelines for MDR-TB treatment? Have you ever wondered how multidrug-resistant tuberculosis is treated? Multidrug-resistant tuberculosis, or MDR-TB, is caused by strains of Mycobacterium tuberculosis that do not respond to at least isoniazid and rifampicin, the two most effective first-line drugs. The World Health Organization, or WHO, has recently updated its guidelines for treating MDR-TB, and these changes are significant. In 2025, the WHO released consolidated guidelines that integrate all existing recommendations into a single framework. This update is based on a thorough review of evidence using the GRADE methodology, which helps assess the quality of treatment recommendations. One of the key recommendations is the use of all-oral regimens. The WHO advises against injectable drugs due to their severe side effects. Instead, treatment typically includes newer and repurposed medications like bedaquiline, linezolid, delamanid, and pretomanid, often combined with fluoroquinolones such as levofloxacin or moxifloxacin. Another important aspect of the guidelines is the emphasis on shorter treatment durations. Whenever possible, regimens of about 6 to 9 months are preferred over the traditional 18 to 24 months, provided that the strain of tuberculosis is susceptible to the medications used. Shorter regimens can lead to better adherence and lower risks of toxicity. The WHO also highlights the need for individualized treatment based on drug susceptibility testing. Rapid molecular and phenotypic testing helps tailor the treatment to the specific resistance patterns of each patient. This personalized approach not only increases the chances of success but also helps prevent further resistance from developing. Newer drugs like bedaquiline and delamanid are now included in the treatment guidelines, as they have proven effective and safe for treating MDR-TB. Clofazimine and linezolid are also recommended as core components of treatment regimens, but their use requires careful monitoring for any potential adverse effects. Monitoring is crucial due to the toxicity of second-line anti-TB drugs. The guidelines suggest regular clinical and laboratory assessments to quickly identify and manage side effects. For example, audiometry may be needed for hearing loss if injectables are used, while hematologic monitoring is essential for linezolid toxicity. The WHO stresses the importance of comprehensive support systems for patients. This includes psychosocial support, adherence counseling, and nutritional assistance, all aimed at improving treatment outcomes and minimizing loss to follow-up. Finally, the WHO encourages ongoing data collection and research to refine and enhance the guidelines as new evidence becomes available. In summary, the latest WHO guidelines for MDR-TB treatment focus on all-oral regimens, shorter treatment durations, individualized approaches, and robust patient support systems. These recommendations aim to improve success rates, reduce adverse effects, and limit the spread of resistant tuberculosis strains. Always consult with healthcare professionals for personalized care based on these updated guidelines.